please welcome to the stage Christine Hill.
Right, welcome to the graveyard shift. We've got hard acts to follow, haven't we? So I hope we'll do you justice. Yes, I'm Chris Hill. I'm a retired senior leader, Spanish teacher really, so it feels very imposter syndrome being here. I've heard some amazing stuff, but I hope you'll appreciate what we've been doing because it will fit in with what you've heard today. We will be starting that movement from the ground up. Just a little personal thing from me. It's quite hard for me to come on this stage. I am someone that's had a horrendous eating disorder from the age of 12, mostly processed food. I've tried everything to get rid of it, and here I am at 62, 50 years later, still trying. I've tried everything, keto, all sorts, and it's really hard. So if I could save one child from the misery that I have lived through, then that would be worth more to me, I'm getting emotional, than all the kids I've taught, all the thousands of kids I've taught. That one kid would mean more to me. On a side note, can I say, I went on a cruise 3 weeks ago, thinking I'd swan in, tanned, great, got COVID. So, so I've got a COVID cough, so excuse me if that's what you'll be hearing, but I'd have to talk a lot, because the real food rebellion isn't me, I'm just nominal lead. There's a team of people who are going to come on the stage now. Here you go. So the Real Food Rebellion is the PHC's new baby, and actually baby is quite a good word because we've done everything we've done in just under 9 months. So we've given birth to this programme, and I'm hoping you'll be impressed with what we've done. I think we've done okay for 9 months. So this is the team, quite a tight team, and that's why we work so well and so quickly together. So there's myself, who's the lead, but I'm also the secondary lead, because secondary was my area of work. Natasha Naylor, we're doing a pre-pilot and we're building the programme with an actual school, Doncaster University Technical College, and Natasha is the lead there, and John Wardell is the IT. They've helped us do the filming, created avatars, so you'll see a bit of that on screen. Mary Bradley, who's not been here, but is an ambassador. Ian Lake, who's sat down there with our lovely T-shirt on. Keris Marsden, who's now in Portugal, nutritionist. Mel Martin's on stage, will be speaking. Josie Moore. They're the secondary. Primary, and Mel, Sue and Louise, who I know has also been around the conference. And then David Sogan, who's TLC, but we've grabbed him for this because he's very good. And Tim Newton's also here. So I'm now going to pass over to David to give you just an overview of the programme and why we're doing this.
Hello everyone. So I'm going to sort of try and explain why we decided we needed a programme for young people. I work as a TLC health coach, and sometimes, you're there trying to help people put their diabetes in remission, and it feels like you're the sort of paramedic at a car crash trying to fix people after the accident's happened. But we know that sort of metabolic disease is a very slow motion car crash, and wouldn't it be better if we could signpost people away from having that accident? And we know from experience that actually if we're going to do that, we've got to start young. So how bad is the problem? So here's some statistics from NHS Digital. So of every 1,000 4- and 5-year-olds now, over 20% are overweight or obese. And that's really the only measure we have of their metabolic health or ill health. And by the time they get to 10 or 11, we can see that about 37% of them are overweight or obese. And that's not really a great place to be. And interestingly, according to a recent publication, European Journal of Public Health, 52% of parents with overweight or obese kids think their children are normal weight. So we've got a perception problem there too. So what about ultra-processed food consumption? Hang on, I've got a timer come up here. Sorry, Sam, can you? Don't know what that's. Okay. Oh, can I have my notes? Sorry, don't run off with those. Don't know what I'm talking about otherwise. So yeah, of the general population of children in the UK, they're getting about 2/3 of their calorie intake from ultra-processed foods. And if we drill down a little bit further into the food that they're getting in school, then primary lunches consist of nearly over 72% ultra-processed foods. And it gets even worse in secondary school lunches. It's nearly 78%. We start them young. So have a look at this list of ingredients for a food product. Can anyone guess what that is? Yeah, you've got it. That's 0 to 6 month infant baby formula. So what are we up against? So we're up against a food industry that spends over $800 million a year on food. And according to a recent WHO survey that looked at several countries, but typically that food advertising, the advertising of unhealthy food typically ranges from 50 up to 90% of the food advertised. And again, according to this article recently issued by Cambridge University Press, there's considerable evidence that exposure to this advertising makes young people make bad food choices. So where's government in all this, you say? Ha-ha. Well, back in 2005, when the government suddenly realized there was an obesity epidemic, they said, we're going to halve it in 10 years. So how did they do? Well, it nearly doubled. But what about the government now? We hear you say. Again, we've heard the government talk about banning advertising of unhealthy food before the 9 o'clock watershed and all that. And of course, what have they done? They've kicked it into the long grass twice now, and now they've kicked it to after the next election, so it's somebody else's problem. So, why a rebellion? Well, we think that, young people are actually growing up in a really toxic food environment. These ultra-processed and ultra-palatable foods are causing, quite serious acute and chronic problems. Those unhealthy young people are going to become unhealthy adults. And people often forget that it's not just physical illness, it's mental illness too. And industry is very good at shifting the blame. It's always saying, oh, you're not moving enough, you're eating too much, nothing to do with us. So they put the blame on young people. And so they're just being bombarded by this confusing messaging. In short, they've been hacked. And what we believe is that young people have a right to really understand and know what is being done to them and have the skills, the tools to be able to do something about it. So what's our solution? So firstly, we want young people to be able to recognize what ultra-processed foods are and high-sugar foods, and also understand what impact that can have on their health. We want to get them angry, Young people get angry about the environment. They should be angry about their food environment too. We want them to understand how the food industry is manipulating their food choices. We want to help them understand, actually, if you eat real food, good food, there's incredible benefits. But we also need to teach them how to access it. We have 2 generations, probably, who don't know how to cook. They don't really know how to recognize real food. So ultimately, we want to have young people in a position where they can make positive decisions to eat real food. We're also very concerned that all the information we delivered is properly verified and vetted, and we've got a great team of nutritionists and doctors who are doing that. But also, in order to get our message into schools, we're not trying to be controversial. We're not going low carb. We're not doing this, that, and the other. We're just saying, eat real food, more of it, and eat less ultra-processed food. And that's our philosophy. So with that, I'm going to hand back to Chris, who's going to tell you a bit about the secondary program.
Okay, so quite a task, actually. As a head, I would often see students coming to school and their breakfast would be a 2-litre bottle of full-fat Coke and a family pack of Haribos. So how do you turn that around? Well, there's a team of 6 in the secondary part of the programme. We are all specialists either in education or nutrition, medicine, and we've come together to create content. Some of us never met till this conference today, which is how weirdly we've worked, but we've worked really well. Doncaster UTC is our partner in this project because to get into schools, you need to do something with a school. It's very hard to get into schools. Schools are busy places, they've got the programmes in place, so you need a foothold. And they're working with us. And the pre-pilot is now happening there. It started 2 weeks ago. We've created a programme that we think is fun, fresh. It's lots of different ways of getting them to understand. And we think the messaging is very clear. And we want children, or young adults in my case, to get angry. Kids love a cause, and we want them to get behind this cause and understand how they have been duped, how they have been used from the minute they were born and put onto baby food, how the food industry's got them hooked, how they're lying to them, and just to wake up. As Eddie's gone, but it's just, I'm not going to use what Eddie says. Although the kids would love it, so I'm going to say, just wake the fuck up. So we wanted the school to have a say in this. I'm hoping this little video will work. So this is from Doncaster.
The UTC's been involved with the Real Food Rebellion because we felt it was a fantastic project to be involved in. The health and well-being of our students is really important to us, making sure that they arrive at school and they've been well fed, they've thought about how they eat, how they're going to look after themselves for the rest of their lives is so important to us. So getting behind this project, developing some lessons and resources to support our young people seemed like absolutely the right thing to do.
So I've been working with Real Food Rebellion, especially with Chris, working on a lot of the content design, also working with them to create the PowerPoint presentations and how this is going to be used with students. We've also then had a lot of input from our students with the terms of the design of the logo for RFR, and that's come back to student panels, which has then ended up with the Real Food Rebellion logo.
It's so important for us that our young people are fueled ready for a really challenging day at the UTC. We know that throughout the day it's really important that students get some healthy food, not just those high sugar foods that are going to give them that quick kick and make them feel a bit better, because we know that that's often followed by a slump later in the day. We're also massively worried about obesity in later life in this country and in general. We want our young people to understand how to look after themselves, feed themselves and their families really, really well. We want them to understand how to do that cost effectively so that they're looking after their pocket as well as their health. We want them to leave here knowing how to look after themselves and to live happy and healthy lives.
I think with the Doncaster demographic, and especially around the broad range of students in our school, there's a lot of content to cover, but a lot about mental health and well-being, a lot to do with just simple changes to their normal lifestyle which can have a bigger impact, and then just understanding, going out into the wider world, how they can make healthier choices.
My name is Mia. I'm a Year 9 at Doncaster UTC. I was involved in the Q&A of Ian Lane. In the Q&A, I learned about the climaxing of food enjoyment and how companies have a tendency to make their food supply meets just below the climax, so that you want to eat more of it, and then you'll carry on wanting more and more and more, and you might ever get that climax. So it's a marketing thing.
Hi, my name's Alfie. I'm in Year 9. I was involved in the Q&A with Dr. Ian Lake. The main thing I learned was about healthy and unhealthy foods and the effects of that. Some of them are decreasing your mental health as well as gaining weight.
The main thing I learned about ultra-processed foods is that they aren't real foods, made in a factory with ingredients, and they're really unhealthy to put in the body, and they can cause problems like diabetes.
I'm looking forward to learning about real foods and how to maintain a healthy diet.
Can I just assure you, I'm sure Ian Lake did not talk to him about climaxing. I'm pretty sure. Pretty sure. I don't know. But she got the gist. So delivery methods. We wanted to have as least teacher input as possible, and you'll find out why in a minute. So we've created the content that's delivered by cartoon avatars that speak the technical stuff. We filmed interviews with Ian Lake to explain what happens to the body when you eat certain foods, what UPFs are. And then there's a range of teacher-led activities, discussions, there's a big workbook that goes with it, there's a teacher manual, and lessons are delivered through PSHE, so within the school timetable. So they are embedded within there. And I've also put in loads of evaluations, questionnaires. This is the first run through. This is like the draft of a textbook. And next year it'll go on and be refined from the feedback that we get, and it'll go out to a bigger pilot with a lot more schools. We're hoping to include local businesses, the wider community, parents, more teachers, retail sector. And we're also hoping to be part of an evidence-based data analysis working with the universities of Wolverhampton, Cambridge, Anglia Ruskin and Edge Hill. My voice going. I'm going to give you some feedback. The programme's been going now for 2 weeks in secondary. They've had 2 hours. And I thought I'd get some feedback from the teachers before I come here, and it shocked me, and I hope it will shock you. So the teachers think that us telling children to eat real food, we've not gone low carb, we're telling them to eat meat, fish, eggs, dairy, potatoes, rice, pasta, tofu. They think that we are extremists. You say, you're laughing, but I've got to get around those teachers. We are extremists, that what we are proposing is extreme, that they are angry we are not in favour of a vegan diet for children. Okay, so my heart sank. And we've only done lesson 2, we've only not even gone into the nitty-gritty yet. So that is quite soul-destroying for me, and that is what we are working with. That is how difficult this is going to be. So I'm hoping, but my beacon of hope is that those 2 students you saw got something, didn't they? They had that 2 hours, 3 hours with Ian, and they got something. So we'll go past the prejudices of the teachers, and hopefully we'll get to the students. And that's our aim. Okay, so that's the secondary programme. I'm going to pass on to Mel, because the content wasn't written by me, I'm a Spanish teacher. It was written by Mel and a team of people. She's going to just explain quickly to you how they work together, because, in fact, I've only just met Mel this weekend, and Mel worked with Ian, and she's only just met him today. So there you go. Mel. I think that's all of mine. Oh, yeah, no, that's what it looks like. They're just a few lessons that are up there, so you can see what they're like. There you go.
Thank you. Okay. If you want to find out what sweaty palms are, come up here. Okay, so why am I standing here? So I'm just going to share a little bit about my personal story, because it's relevant. And I imagine that actually it should resonate with a lot of you, because I imagine that a lot of you sitting here today have your own kind of personal stories that got you interested in kind of a slightly different way of addressing your health issues. So I have personal experience of the extraordinary power and efficacy of diet and lifestyle change on health. What we eat can literally kill us, albeit slowly, or cure us. My own story is one of a lifetime of often crippling IBS and an unhealthy relationship with food from my teenage years, which by my mid-20s was manifesting in restrictive diets coupled with binging, purging, and enormous shame. I said goodbye to my symptoms of IBS during my training as a nutritional therapist at ION, and a private consult with one of our lecturers, Dr. Michael Culp. 35 years of having to be intermittently chained to a toilet with no rhyme or reason about what would cause a flare, and then it was gone. It turns out that the healthy whole grains weren't quite so healthy for me. After I qualified as a nutritional therapist, I started learning about metabolic health, what messes it up, and how to rebalance it. I discovered that I could be free from hunger and restrictive diets and eat delicious, real food. And I stopped weighing myself countless times a day and counting calories. My days of hangriness are gone and haven't returned, and I'm well. Nearly 53 years old and medication-free. But I don't think that just addressing metabolic health is enough. Countless people are still struggling. You know why? Because we are all hopelessly hooked on fake, super tasty, chemical-laden, industrially produced food-like substances that we call food. I think our real epidemics are addiction and misinformation, driven by an almost completely unregulated billion-dollar fake food industry. If we're to stand any chance of even reducing the skyrocketing levels of ill health in our modern world, we need to find a way to combat the incredibly sophisticated messaging from the food industry aimed at getting our children to be their next batch of lifelong super consumers of their fake foods that are stealing our health and quality of life. If this sounds extreme, it's because it is. And if we don't do something soon, it could be too late. And that is why I have given my time for free to help with this project. We can help ourselves, but only if we wake up, step out of denial, and start to teach and normalize eating real food, a proper human diet, once again. And that starts with our children and young people, because they are our future. That's not right.
It's down, the down one.
Oh, thank you. Okay, so the content team consisted of Dr. Ian Lake, who I have just met today. Such a pleasure. Thank you, Ian. Who is creator of the Clinicians Insulin Optimization course and founder member of the PHC. Me, Keris Marsden, who's a naturopathic nutritional therapist and who's recently moved to Portugal, and Josie Moore, who has an MSc in nutrition science and is a trainee naturopathic nutritionist. So that was our team. So we created 10 hours of content. How did we do it? Do you know what? It was really quite simple. Considering that we've never met each other in person, any of us, and we all did this in our spare time, and we're all busy people, we collaborated. And we had a shared passion. Our egos were left at the door. Because you know what? Egos are the death of many of our projects. And we didn't have death by Zoom. So essentially, we met, we decided what we were going to do, and we did it. And I have to say, Chris says she's kind of like didn't have much to do with all of this. Chris drove this project. It wouldn't be here without Chris. She was amazing. So thank you, Chris. Okay. So this is just an example of the sort of thing that we came up with, really. And hopefully, this is going to go from strength to strength. And we're going to get those teachers who think it's too extreme on board. And we're really going to make a difference. So thank you.
Okay, now passing over to the primary team, who are Mel and Sue.
Hi, are we going? I'm just a teacher. I really am just a teacher. I've done primary, I've done secondary, I've done special. Yes, I have a history with all of this, but I want to tell you about 2 children, and those 2 children were one, he was 13, and he said to me, "Help me, miss," because his belly was beyond his knees and he was mortified. And they wouldn't let me give him this information. They told me I couldn't, I wasn't qualified, and they needed a dietitian who he'd seen, and Mum had lost the sheet. And the other was an autistic boy who, he said, "Don't be frightened of me, miss. Please don't be frightened," you know. No, I can't go into it, but smashing windows, and there was a lot around there. That was the environment I was working. I'm here for those children and for all the primaries that I've been through in all of those so-called high social deprivation schools. That's why I'm here.
And I'm really glad that Mel's on this project because she's been amazing to work with. I'm Dr. Sue Beckers. I was a GP with my husband for 30 years, and we saw all those chronic diseases increasing and didn't understand why. So I put myself on a nutritional medicine master's course, and it still didn't really give me the answers, but I did learn about real food. So my project for that was to design something for my children, because I was so worried about all these kind of packaged foods that were coming in that they were putting in their lunchbox. And we're talking about 2007 now. So I designed a kind of sheet that they could use in a little research project that I set up in primary schools, and a whole kind of teaching program. And that lunchbox teaching program, I thought, would be a really good kind of basis that we could work from, maybe to design something that was more up to date. So do you want to introduce to the rest of the team?
I think they've been through them. Oh, other than Josh. And Josh, oh, how fantastic. So you'll see some cartoon characters coming up, and Josh was our illustrator for that. And then, I forgot Sharon, so I'm pretty rubbish at this. So Sharon, God bless her, has been in schools forever, and she does the cooking with the little E's, and so she helps us with some of the recipes too.
So we've got our pre-pilot happening at the moment, and we're really excited because this is across the country. Well, it's the length of the country, and the pre-pilot at Dunsville has happened, and the feedback we've got was brilliant. They really enjoyed it. The teacher enjoyed it. Their children enjoyed it, and it chimed with the learning that they're doing at the moment. But it made them ask questions and have debates, and they did cooking in the classroom. They were inspired to do things, and at home. So we're really excited about that. So the whole teaching program that we've designed centers around a story. And the story, you've got to remember, we're actually aiming this for 6 to 7 year olds. So this is a gentle story about Tim, who lives in an urban environment and eats a lot of ultra-processed foods. He's sent to stay with his aunt in the country, and he feels really cross because she hasn't got the internet, she hasn't got his favourite foods, and, oh, yuck, there's a girl next door. But when he goes to see the girl, she's playing football, and she won't have any of his ultra-processed foods. And we never use that term in this programme. But Lizzie decides that Tim needs to come with her and do some picking from her mum's garden and cooking. And so together they kind of explore real food and do lots of cooking and enjoying and tasting.
Bloody hours I've spent on this thing, all right? Days and days agonising. Did I know that my audience was going to be you lot? And I was going to be... No. Canva. I'm proud of it, but I didn't know what I was doing. I just wanted the children to be engaged, to motivate them, they have to own this material, this message, and that's what I was going for. So be gentle with me, please. I tried my hardest. So, children don't really want to listen to adults. Even the little E's know better. I know better. So what I used was the characters to lead the lessons. That also helped with the teachers, because teacher knowledge and bias was going to be a big issue. So what you can see here, I've had lessons that are given as video. They just have to run the video and the children talk them through it. And I've got worksheets to back that lesson up. And we're developing this, remember. So, I'm open to change. But we have worksheets, and the focus of the worksheets is discussion. We want the children to talk about this, not to be passive learners. Well, that's my aim anyway.
And we sent them home with recipe sheets for very simple things that they could do at home with their parents or carers. And bless her, the teacher from Dunsville got them all making fruit kebabs in the classroom, and they were tasting things like blackberries, which actually some of them hadn't tasted before. And we've got a lovely picture that we'll show you one day of a little boy who went home and very proudly made flavoured water by stuffing loads of cut-up apples in a jug and pouring water on. And so they've really enjoyed experimenting with all of this. We've actually got some videos from the teachers themselves. So from Achtamukti in Scotland.
I've been practicing that.
Oh, sorry, you say it.
Octomukti. Polly, is that right, love? Octomukti. Oh, sorry. It's the ending I need to work on. Yes, I'm really thrilled that Scotland wanted to become involved, and it was just a casual conversation with Polly, who then went to a school, who's an ambassador for the PHC. And and then I've got to say that the response has been brilliant from the head teachers and the deputies. All I have to say is, what are these children coming to school eating? What is their mood like? What are they like after the snacks? And we know what the snacks can be. What are they like in the afternoon? We're talking about behaviour in the main. Our teachers are struggling. I was a behaviour specialist, so, I would have, but they need this. And so, over to Octomukti. That one. And Dunsville.
We're excited to support the pilot of the Real Food Rebellion School Resource Pack and Missing Materials. Our children's health and wellbeing is a priority for both our schools, and this programme of work is comprehensive in supporting our teachers to deliver aspects of the Scottish curriculum in both health and wellbeing and food technologies.
And from Sarah at Dunsville.
Hello, my name is Sarah and I teach a Year 2 class. I've been teaching healthy living using materials created by the Public Health Collaboration. The children have enjoyed listening and engaging in questions instigated by the story of Tim and Lizzie. They've enjoyed listening to and singing the song I Like Real Food, which focuses the children on where real food comes from, a farm, a field, a tree or the sea. The children have enjoyed making delicious water using cucumber and lemon, and enjoyed making fruit kebabs to secure their understanding. Many have been able to make healthier choices based on their learning.
And we want to give the last word to some children who are singing that song that they all learn in the story.
I like real food, food for my body that works for me, from a farm, a field, a tree or the sea, not something made up in a factory.
All together now, all together.
Oh, Tim, hold on a minute. Hold on. Bit previous. Before we move on to Tim, who's sort of logistics and will tell you what's happening next year, can I say a public thank you to this team? We have not had a penny of funding. We have given all our hours, hundreds of hours, for free. And I think to create a programme from scratch from September we had nothing, to now being in actual schools and teachers talking to you, is, if you know schools, that's just an amazing achievement. So thank you to the team. I'm now going to, last bit, hand over to Tim, who is sort of logistics, will tell you where we're planning to go next year and how you can become involved if you want schools that you know to become part of the project.
Right, I won't detain you long. It's been a wonderful but long day. But okay, so where do we go from here? And I'm, if you like, the recruiting sergeant for the next phase. Just briefly from me, I'm PhD ambassador for Ipswich, retired teacher, and I've been in education all my life. I didn't get into this through personal health issues. I just wanted to run faster. I'm a founder member of the Real Food Runners that we haven't really mentioned. So a shout. You'll have seen plenty of us around the place. And I'm also managed to qualify a few times for England Masters team, as a result of the impact of lower carbon being fat fueled in my running. I've also, many of you will know about Ian Lake's 100 miles in 5 days, zero calorie experiment. I decided to replicate it just by running from home. I won't say it was easy, but it just shows what is possible with even an ancient human body. And so the real importance here is I'm the coordinator of next year's pilot program. So as Chris has said, we're going to evaluate the current schools that you've seen, and obviously we will revise and adjust the materials for next year. We're currently recruiting for this main pilot, and we're intending to run it next summer term, so quite a lot of time to revise and prepare. We've had a lot of interest already, so we've got potentially 18 secondary schools, 12 primaries, looking still for a few more. So if you are either a member of staff at a school, or you know of a school where you think there is potential to become involved, then please get in contact with myself or any member of the team. It does, of course, need support. It's got to be a whole school initiative, so it does need to be supported at senior leadership and possibly also governor levels. We've been sending out an information pack going out to all schools with some of the course summaries, a form to register interest, and the terms of agreement upon which we are going to operate. And if you bear with us, just here's an
Welcome to the Real Food Rebellion, and thank you for considering to be part of the main pilot phase for this programme. The Real Food Rebellion, or RFR for short, was born out of a concern for the growing number of children living with chronic conditions such as obesity, type 2 diabetes and fatty liver disease, as well as poor mental health. All of these are frequently linked to poor nutrition and unhealthy lifestyles. There has been an exponential rise in these conditions in young people, and the government are failing to tackle the problem. They continue to allow our children to grow up in a food environment where they are bombarded by clever marketing, resulting in them eating increasing amounts of ultra-processed, nutrient-deficient foods through no fault of their own. RFR is aimed at both primary and secondary school children, educating them with the most up-to-date science. Both phases of the programme have been written by NHS health professionals in conjunction with experts in education. It is designed to empower young people with the knowledge, skills and confidence to navigate the modern food environment, allowing them to make appropriate choices for better long-term health and happiness. What makes RFR different is the involvement of young people and the participating schools in the creation and refinement of the content. We want to develop a programme that is accessible, interesting and relevant to young people. As a participant in this pilot, your staff and students will play a key role in assessing the pilot materials and shaping the final programme. The RFR Primary School programme consists of a 30-minute story, available both as an animated film and a storybook. It is broken down into 6 lessons, each coming with worksheets and recipe cards that can be used either in class or at home. The secondary school programme has up to 10 one-hour lessons. However, we are conscious that most schools do not have the luxury of dedicating this much PSHE time in their curriculum. So the programme is designed to be flexible and can be adapted to each individual school's timetable with either fewer or shorter lessons that still deliver a programme with a high impact. The overview of the contents of both phases are included in the welcome pack. Alongside the lessons, there are staff training videos, a student workbook, and for secondary schools, a teacher manual as well. We are also including a parent-carer engagement programme consisting of information via short videos. These include advice on helping their child access a healthy diet, essential cooking skills, budget-friendly recipes, shopping lists, and much more. We hope you will join us in shaping the future of our nation's health from the ground up.
Relax, last slide. And as all good teachers, on time, because that bell's going to go. So how can you help us? This is, like I said, a really rough draft. It's been done by us. It looks like a teacher PowerPoint and teacher things, although Mel's put a lot of work into Canva. We go into a lot of schools next year, and it needs to be more professional. We need to get professional people in to help us. That costs money. And then after that, after schools have been in the pilot, which they'll do for free, so let schools know if you're in the pilot, it's free, because after that, it's being sold as a PSHE programme to schools around the country. So it'll have a cost, and that money will come back into the PHC. So you can buy a T-shirt. There's lots of lovely bodies wearing them. Ian and David and Tim, and not you, Sam. If you want to get involved, you can grab us or email Tim, tim.newton@phcuk.org. And David, I only walk the dog twice a day, but I'm surrounded by all these runners and rowers. So David is actually going to do a challenge of rowing 100 kilometres, and all the money from that will go to RFR. So if you'd like to sponsor him, he has got a total giving page, and he's even been clever enough to do a QR code that sits on the RFR desk. So any money that you give will go straight to developing the programme and make it as slick as possible for next year. And bearing in mind we've not spent a penny yet, I think we're owed a bit of moolah. Thank you. That's us. Thank you for listening. End of the day. And